and today I'm going to talking to you about saggy skin, the layer of the fat and in the layer of the SMAS. Retinol is a wonderful cream which increases the collagen synthesis, makes the skin tighter, like the change in the color, change in the texture, dullness of the skin. So if it is not retinol, the solution is not retinol, then what is the solution? Hey guys, I'm Dr. Rasya Dixit. I'm a dermatologist in private practice in Bangalore from the last 18 years. And today I'm going to talking to you about saggy skin. We all know that saggy skin is a big concern for most of us, be it saggy skin around the eyes, on the neck, on the face, on the body. And saggy skin or wrinkly skin is one of the first signs of aging, and we all want to know what is that one treatment that you can do to fix it. Let's talk about the most important creams which are there in the market, the retinol creams. Is it worth it? Should you buy a retinol cream? If you have a severe sagging of the skin, be it loose skin in the under eye, whether it is in the jowl area, on the neck or on the arms, retinol creams are not going to work for you, and that is the short answer. The long answer is that the aging of the skin, the wrinkling of the skin, the sagging of the skin does not come from the upper layer of the skin where retinol is able to work. Retinol is a wonderful cream which increases the collagen synthesis, makes the skin tighter, but that is at the most superficial layer of the skin called the dermis. But the sagging of the skin, the wrinkling of the skin is happening at a layer which is deeper to the skin layer, which is in the layer of the muscle, in the layer of the fat, and in the layer of the SMAS, which is the aponeurotic system which connects the bone of the face to the skin of the face. So sagging in these three layers, which are the deeper layers of the skin, is not going to be addressed by retinol. So if it is not retinol, the solution is not retinol, then what is the solution? For that, we need to get into a little bit of understanding about the nature of the skin and how aging actually occurs. The skin is made of 5 layers, and when we talk about the skin, we are talking about the epidermis and the dermis, which form the topmost or the outermost envelope of the skin. Below it is the layer of subcutaneous fat, which is present in compartments. Below it is the level of the muscles, which are the facial expression muscles, which are connected to the skin and by which we make the emotions appear, like frowning, smiling, appear on our face. Below that there is another layer of deep fat compartment, and then you have the musculoaponeurotic system followed by the bone. So all these layers actually give rise to the appearance of the face. When we have aging, the first few changes are there which are noticed in the epidermis, like the change in the color, change in the texture, dullness of the skin, and little bit very superficial wrinkling. And yes, these are the ones that retinols and retinoic acid can target really well. But when the changes become deeper than that, and when I say deeper than that, you start manifesting it as crow's feet or wrinkles around the eyes, frown lines, forehead expression lines. These lines are coming because of the expressions of the muscles, because we are animating when we are talking on a daily basis. We might be frowning at our children, we might be smiling at our friends, or we might be raising our eyebrows to convey a surprised expression. And an overaction of these muscles leads to the formation of dynamic and static expression lines. And these expression lines have to be treated by the use of neurotoxin or neuromodulators such as botox. Now when we come to the loss of fat, this is another area where we can target very well with use of fillers. The next layer which could undergo a volume loss is the fat. I spoke to you about two different fat compartments in the skin, the superficial fat compartment and the deep fat compartment, and both of them can undergo aging at different ages in life. And when we undergo aging, it's not that all the fat compartments is lost at the same time. Most commonly, the under eye compartment is lost in your early or mid 20s, which is why the appearance of hollow under eyes is very common in this age. And coming into your 30s, you start losing volume in the mid cheek area, in the nasolabial groove area, in the marionette area, in the pre-jugal sulcus area, and all these areas are going to contribute and going to add on, and they can be treated very easily by the use of fillers. Fillers are a gel which are based off of hyaluronic acid, which can be injected under the skin into these volume deficit areas, and they will rejuvenate very naturally. They will restore the volume to the face and give a youthful glow and hydration back to the skin. But not all of us are ready to go for these injections to treat our face. So what are the other methods by which we can naturally rejuvenate the skin? With radio frequency, you have basically a machine which delivers heat deep into the dermis, the under eye area as well, to tighten the sagginess in the under eye area. Treatments of RF tend to be cumulative and they need multiple sessions to give you full results. So HIFU is a better treatment if you have a more saggier face. And what would be the treatments and how early can you start them? Always remember that you have to complement these treatments with your diet, with your exercise and your lifestyle changes.